Hi, everyone. Welcome back to Dental Hygiene Basics. My name is Dana. I'm your host. I'm excited to be here. And I'm really excited because I had a listener question. I had someone reach out and they asked, have you ever done an episode on imposter syndrome? Because right now I'm going through dental hygiene school and I'm really feeling like maybe I don't belong here. I'm struggling in my classes. I feel like I barely made it through last semester, and having all of these seeds of doubt. And I was very grateful that this person reached out and asked me because really that's what I'm here for. So if you're listening to this episode and you're struggling with something, please, please, please feel free to send me a message on socials or through email, and I will answer that question for you because that's what we're here for. Before we get started, I do want to talk a little bit about dental hygiene basics and some things that we offer. We're here to help students get into and succeed in hygiene school. So, what does that look like? We give resources here on the podcast, always for free, to make sure that you have all of the information that you need to be successful. We also have scholarships. So, head over to dentalhygienebasics.com to see our scholarships page. And we offer tutoring as well. So, we actually have 3 tutors on board right now and hoping for more in the future. If you're struggling in a subject or if you're struggling with national awards, please reach out because we would love to help you. All right, beyond that, let's dive into imposter syndrome. Imposter syndrome is that feeling like you're not quite good enough or you're not sure if you can actually do this. Do you belong here? Do you have the skills to make it through and pass this program? And I just want to let you know that most people have imposter syndrome. I think if you just have bold, insane confidence and you're like, yeah, I can do this all, like I can do anything, I'm going to be fine. You may be bordering on some type of like delusional personality type, right? It is normal to question whether you are on the right track and whether you are going to be able to succeed. The thing is, we have to consider how are we going to manage those thoughts when they come up? Because if you let them take control, they are going to derail your process. They are going to derail your progress and they're going to prevent you from being successful. So, we almost do need to lean towards a more delusional way of thinking while also reflecting on what are we experiencing in the moment? What kind of feedback are we receiving? What do our test grades look like? What do our scores look like in the program? When you start scoring well, that's telling you you're on the right track. If you feel like you barely passed a class or you feel like you're just on the fence at all times, like it could go either way, you could pass or fail a class or the program, then that means that you need extra help, right? So there's a difference. If you're routinely performing well and your scores are showing you're on the right track, imposter syndrome is something that we need to work through internally. So, what does that look like? Every time you notice those thoughts, you have to be able to pause and be aware of the thought. You can't let yourself sink into a spiral of negative thinking. You have to be like, "Oh, I realize that I'm having thoughts that I'm not good enough, or I feel that panic kind of rising in my chest, and I'm thinking, I'm going to fail this test, I'm going to fail this exam, right? All of those are just thoughts. Thoughts do not always match your reality. So, we have to stop, notice the thought, figure out where the anxiety or the imposter syndrome or those negative thoughts are coming from. Try and float back and follow those thoughts as far as you can. Try and figure out where they are arising from. Maybe you're telling yourself, I'm going to fail. I'm terrible in dental hygiene school, but really you're mainly struggling in one class. Okay, we need to put some more focus on that one class and get help in that one class. Or maybe you're putting things off on your to-do list because you know they're going to be hard to tackle, right? And then you just go into this mental downhill spiral of, oh, I can't get anything done. Why am I a procrastinator? Why am I so lazy? When really you're just having the hurdle of getting over the step of doing that one hard task, right? So there are different kind of things that may be holding you back in dental hygiene school when it comes to mental blocks or imposter syndrome just mentally. Now, if you're on the other side of the highway here, you may have imposter syndrome, but you may also be actually struggling in dental hygiene school. And the most important thing that you can do is recognize it. So, the first thing that I tell all students really who are embarking in dental hygiene school is you have to have a time for self reflection. One, celebrating your wins, because just think about your first day to where you are now. Think about how far you've come. Even if you rode the coattails of passing your classes, you've made it through and you've gotten to this point, right? But we also don't want you to just keep pushing forward when you're having these feelings of doubt, inadequacy, if they are really rooted in struggles. If you are actually struggling in your classes, you can't just be like, it'll get better or positive self talk is going to fix it. Those things will help, right? Supporting yourself, taking care of yourself mentally, but also we have to put the work in to make up for lost time. Okay, so right now, if you have time before your next semester, I'm going to encourage you to look back and reflect on your previous semester or your previous exam or previous quiz, whatever it is that just happened, and see, how did I perform? Did I perform to the level that I want? No. Why did that happen? Why am I struggling in this class? Is it because I don't understand the way the teacher teaches it? Is it because I didn't study enough? Is it just a boring subject to me and I have trouble engaging with it? Okay, any of those can be realistic reasons for why you're struggling. It could also be because you're not just managing what you're learning in class and then applying that to an exam in class. You are juggling so many different things. You're juggling clinic, you're learning new clinical skills, you may be seeing patients. There's so much going on, not even including your external life. If you have family, if you have external pressures, if you have to work while you're in hygiene school, there's so many things that you may be juggling right now. And I just want to let you know that, again, it's okay. And there's always room to turn it around, but we have to have that self reflection first. Okay, so if you're reflecting and you're like, I really did not perform very well on that quiz, if I barely passed, a lot of people say C's get degrees, and that is true. But C's also cause stress throughout the program because you may be hovering on that pass fail line. And what we usually see is if you're hovering on that pass fail line early, it doesn't get better, and it tends to show up again when you take your board exams. You may be hovering on that pass fail line and may have difficulty passing the boards. So I want to get you as strong as possible, as early as possible in the program. And again, there is always time to turn it around. I have students who were hovering that line the entire time. They knew they were a little nervous. They came to tutoring for national boards, right? And then they were able to go on and be successful. So, I want you to keep in mind that as soon as you notice that there is a problem or you start to feel those concerns that there is a problem, you need to take action right away. Okay. That action may look like going into your teacher's office and having a conversation, asking for help. Start studying with the students who are studying all the time, right? Who's getting A's in the class? I want to be seated next to them and I want to ask for their help and I want to engage with them, right? I want to put myself around people who are being successful and hopefully some of that success rubs off on me as well. The other thing is sometimes you just need to get external help, right? Maybe that's a YouTube video. Maybe that's a source that you find in another textbook, or maybe you're asking for help from someone like a tutor, which the beauty of a tutor is they're going to do the heavy lifting for you in terms of the content, the material. You're not going to have to go search for endless YouTube videos to try and figure it out. You tell them what you're struggling with, they're going to bring it together to session and you're going to work on it together. That is the nice thing about tutoring. The other thing to factor in is with all the things that you're juggling, really creating an organized system for how you're going to be prepared for every test, exam, clinical day. If you don't have some type of organization, it's going to feel like an endless hurdle. Where do I start? Where do I go next? Right. And it's important to identify what is the priority for today. Okay. This is really good, especially when we're dealing with things like finals week where you have so much going on and you're like, what do I focus on first? You have to decide what is the top priority for today. And I recommend trying to keep those top priorities down to maybe two or three big priorities. And then that is going to be the first thing you focus on, right? So you wake up in the morning and you're going to dedicate 2 hours to your priority or whatever that looks like for you. Okay. Once we start getting those priorities out of the way first, it lowers the overall stress level and it actually opens up because you feel a little less stressed and overwhelmed. It kind of opens you up to be able to accomplish more things, right? So once we get those big things out of the way, and maybe that's just I'm going to study for 1 hour today for a test that I have in 2 weeks, right? And I'm going to be building on that, building on that. And so that by the time those 2 weeks have come around and it's test day, I've studied an hour a day for 14 days. I've studied 14 hours for this exam, right? Think of it in smaller, more manageable chunks. The more you can do smaller, more frequently, it's going to help you be better prepared. It's It's also going to help prevent you from being so overwhelmed. The other thing I want to mention when it comes to imposter syndrome and feeling like you don't belong or that you're not going to gain these skills, most of us have been there. Okay. So they say around 70% of high achieving students actually have imposter syndrome. And dental hygiene school is filled with high achieving students, right? So you're in good company. It makes sense that you feel this way. It's just kind of ingrained in who we are as human beings to want to be perfect, to want to feel like we're doing things right, especially when you are having to perform skills in front of an instructor. Your classmates are usually around while you're performing these skills. Sometimes you're performing skills on patients in front of instructors, right? There's so many people watching. It can feel so overwhelming and you feel like you're failing out in the open. I want to encourage you to embrace that, right? You know, you're going to be on stage. Think about a person who, works on Broadway, right? They know they're going to be on stage. That is their job. So what do? They rehearse their lines, they practice, right? I want you to treat life like you're going on stage or like you are an athlete getting ready to compete, okay? How are you going to prepare for that moment? Sometimes shifting, if you were an athlete growing up, kind of shifting out of that mindset of now I'm a student athlete, right? My athletic endeavors are related to learning now. Try and shift that mindset, and that's going to help you to perform better. But also remind yourself the better I prepare, the less I'm going to fail. But also, if I do fail, it's okay because that is a part of the learning process. The thing is, we have to catch those failures early and figure out what went wrong. And that's why I was talking so much about self reflection early on. The last thing I want to encourage you to is to build confidence through repetition. Nobody picks up an instrument for the first time and knows what they're doing. By the end of my first semester, I did not feel confident at all to touch a patient. And they were like, yeah, you're going to clean a patient's teeth, as soon as you come back next semester. I was so scared out of my mind. Totally normal. By the time I graduated dental hygiene school and I was taking board exams, I did not think I was going to pass the board exams, the physical, the hands on component. I was like, there's no way. I don't know what I'm doing. Okay. Granted, this is after 2 years. If we go back and we think about pre-clinic, when I learned to pick up an instrument and how to hold it and how to scale it, I had come so far. I had cleaned so many patients' teeth. I had passed, my competencies and all of this. And I still thought I wasn't going to pass my final board exam. I went on and passed it. And guess what? I graduated, get into practice. First 2 to 3 years of practice, I routinely thought, I do not know what I'm doing. Okay. These are common things that people feel when you're learning, right? It takes time to master something. They say it takes like 10,000 hours to become a master in something. So I want you to take a little pressure off yourself because you are a beginner. When you graduate dental hygiene school and you take your board exams, they are testing to make sure that you are minimally competent and that you are safe enough to treat the public, right? Minimally competent, that's where you need to be when you graduate. If you are graduating above minimally competent, good for you. That's amazing. But I just want you to realize this is a learning journey. We are continuing to learn and we're going to continue to learn through our failures, and that's okay as well. All right. Thank you so much for being here. I appreciate you listening so much. If you enjoyed this episode, I would love if you would like, subscribe, follow wherever you're listening. Give me a review. It really helps me to get this information out to other students just like you. And if you have questions, please feel free to reach out and ask. All right. Best of luck on your journey. Future registered dental hygienist.